The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make good medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hello, this is Good Medicine. I'm your host, Larry Pitts. Today, I have a distinguished lady with me. It's Diedre Bethune.
Diedre Bethune.
Bethune.
Yeah.
And she is a nurse practitioner at the Medicine Tree. And Diedre, do you want to say hello to anybody out in TV land?
Sure. Hi, everybody at the Medicine Tree.
Cool, that's great. Diedre, you've been a nurse practitioner for a while now. Mm-hmm. How many years have you been a nurse practitioner?
For 7 years now, going on 7 years.
And what does it take to become a nurse practitioner?
Well, initially you have to be a registered nurse, and then you need to have some advanced training, and nowadays you have to have your master's degree, which is 2 years worth of postgraduate training.
Actually, my sister is out at the University of Washington right now becoming a nurse practitioner psychiatrist.
Oh, wow.
She's trying to figure out me. We told her that would never work, so. What is a nurse practitioner?
A nurse practitioner is, as I said, a registered nurse who has some advanced training, and we do a lot of the same basic kind of primary care that physicians do. So we are practicing medicine in a sense, only most nurse practitioners don't want to call it practicing medicine because we are nurses, and we all like to think of ourselves as in the nursing profession, which we are. And we see patients. Most of us have our own practices, and we treat a lot of minor illnesses and do well care for people. Lots of education. Education is one of the most important things that we do, which makes us a little bit different from physicians. We take the time to really talk to our patients about what's going on and trying to do a lot of preventive care as well.
So what it sounds like to me, and in reality, is you spend a lot more time with the person.
In most cases we do, as much as we can. It's one of the nice privileges of being a nurse practitioner.
So how long have you been associated with the Medicine Tree up in St. Ignatius?
I've been with Medicine Tree in St. Ignatius since it opened, which has been about 2.5 years now. I've been with Mary at the Medicine Tree down in Arley since 1992. 91, 92, somewhere in there. So I've been with them for a while. 5+ years, huh? Yeah.
All right. So how's that association been?
It's actually been quite wonderful. I feel real privileged to be able to work in an organization where we're able to provide our patients with the kind of care that we give, which I feel is pretty comprehensive. I think that people come to us because we offer a little bit more than a general medical clinic, and so I feel very fortunate to work for the Medicine Tree.
All right. Well, you know, as I'm sitting here and I'm thinking about questions, and you know, and your presence is wonderful. Maybe not quite as sensuous as Paul Coates, but but it's there. Paul will like that one. Most practitioners, whether they're MD or nurse practitioner, tend to have specialties. Do you have a specialty?
Yes, I do. I initially was called an OB/GYN nurse practitioner. Now it's more developed into women's health care, which is pretty much the same thing. So I take care of women in most facets of their health care, mostly with GYN problems. I am also trained to do prenatal care. I do not deliver babies. I used to when I was a registered nurse, but I don't do that now. I'm not a midwife.
Okay.
But I do take care of women who are pregnant, and so I have the fortunate privilege of helping to bring new life into the world as well. So women's health care is the main focus. So I see women with all gynecologic problems.
So you're actually, what you're seeing is a woman from the birth until geriatrics.
Well, pretty much, except that I do not see children. Pediatrics is not a part of my practice. I will take care of a woman during her pregnancy, but once the child is born, then that responsibility goes to a family physician or to a pediatrician.
Or back to the mother.
Right, or back to the mother, that's right.
What is your philosophy for caring for a patient?
Well, I basically like to teach my patients about self-care as much as possible. I think that we all need to learn how to take good care of ourselves. And my job as a provider is to help you to learn preventive care and the things that are going to help you to lead a healthy lifestyle. And so when I see patients, I like to spend some time getting to know them as people and learn a little bit about what they do for a living and what their home lives are like, so that I can possibly have some effect on helping them to understand how the way in which we live affects our bodies and our physical well-being. So the mind-body connection is something that I like to talk about with my patients. And self-care, I believe it's really important, prevention.
Now, you know, as I look at a newsstand and I see all these magazines, they talk about self-care, preventive care. Is there a difference between self-care and preventive care? And could you go into each a little bit for somebody out there who's saying, well, what is self-care?
What is self-care? Self-care means knowing yourself and being able to know your body well enough to know what's healthy for you and what isn't, okay? Diabetics clearly have difficulty with sugar, and so self-care means that they learn what is appropriate diet for them and what isn't, and that they live by those standards. Self-care is anything as simple as not smoking, because we know what the hazards of smoking are on the human body. Self-care means that you wear your seatbelt when you get in the car.
Or you ride with other kids.
Right. Okay. So self-care means taking care of yourself, liking yourself well enough that you pay attention to the signals that your body is giving you, and you follow through on those things. Preventive care is knowing what kinds of things can lead us to unhealthy lifestyles. Prevention means things like doing a self-breast exam on a monthly basis for a woman. Means taking care to brush your teeth so that you have good oral hygiene and that sort of thing. So prevention means doing the sorts of things that are appropriate so that we don't become ill, okay? So that we don't get sick.
Okay. Why do you think it's so important in this day and age for preventive and self-care?
Well, it just generally leads to healthier living, basically, is the obvious reason. But one of the things that's happening is that we no longer have the kind of insurance coverage and the medical backup that we have had in the past. You know, I know that in the Indian Health Service, the funds that have been available in the past are not quite as readily available as they used to be. So if we learn how to maintain a healthy lifestyle, then we don't need to use our funds for disease prevention or disease care. Rather, we'll stay healthy longer and not use those funds unless they're absolutely needed in a crisis situation.
Well, you know, and you're really touching on a touchy subject with us in tribal health, because we know that even though inflation continues, they're cutting our budget, the amount of money a lot of times, and so we have to become better stewards. How can you, as a nurse practitioner, how can you help somebody become better at self-care?
I think mostly one-on-one contact and teaching. I think that a lot of times we get so fast-paced in our everyday living that we forget to take the time to do the things that are going to make us feel better. Things like exercise and good nutrition and getting enough rest and taking care of our emotional needs, that sort of thing. So if we can sit and talk about those kinds of things and devise plans so that that becomes a priority in your life. I think those are the ways that I can be most helpful.
Well, this is really, actually, this is real interesting to me because I'm sitting back now and I'm taking a look. What I'm hearing you say is that you're not looking at these little channels. What you're trying to do is look at the overall picture, right?
Yes.
Now, what's the purpose of that?
Well, as we've said, so that you can maintain a healthy lifestyle, you know, so that we can all live to the ripe old age of 90 or whatever it is that we'd like to live to.
Hopefully 40.
Yeah, I mean, the healthier that you live, the happier I think that you can be, and it helps you to be able to deal with the rest of your life in a more appropriate manner.
What kind of services can you offer your patients?
Well, in women's health care, I do basic gynecologic exams, which means a pap smear and a breast exam. And included in that exam, I also listen to the heart and the lungs and check the thyroid. I can do blood pressure screening and cholesterol screening and counseling and that sort of thing. I take care of women who have urinary tract infections. I do a lot of family planning. I take care of women in menopause. Any female-related problems are things that I am capable of taking care of. I do some screening when women come in and feel like they might have an infection of some sort. I can do blood work and ferret out some of those kinds of problems as well. One of my other jobs is to be able to pick up when something more serious is going on and when it's necessary for that patient to see a physician. So my job is then to refer the patient to a physician so that they can get the care that they need.
I was at a talk, this has probably been a year ago, and I was giving the talk, and we were talking to a bunch of young women, and the question came up, when should a young female have her first pap smear?
As soon as she becomes sexually active. And in this day and age, our young people are becoming sexually active at a much younger age. So if a woman is sexually active at the age of 14, then she should be getting her first pap smear at that age. If she's not sexually active, then I would say 18 years old is the right time to become coming in.
What is you just mentioned that one of your specialties is family planning. What does family planning mean?
Family planning is it means to help our young people figure out about their fertility, what to do about birth control. Also, it has a great deal to do with sexuality and helping young people explore ways in which to prevent them from getting sexually transmitted diseases. Birth control is a big issue in this county as well as throughout the United States, everywhere you go. And because of the fact that our young people are becoming sexually active at such a young age, it's really important that we get the information to them on how to prevent pregnancy. Unfortunately, we're seeing a lot of children having children these days. So family planning is a big issue, and it's real important. So it doesn't mean just handing out birth control, but it means a lot of education about how our young people can cope with these grown-up adult issues that they're being faced with at such a young age for various reasons.
Well, and there's a lot of choices out there.
Right. There are a lot of choices.
You know, and I guess that's what I see the value of education is at least they have a lot of information that they can choose where they are heading and what can derail them from in the future.
Right.
What do you see your job as far as working with young people today? What is your job?
Well, aside from working at the Medicine Tree, I also work at Job Corps. And I do similar things there. I do the family planning clinic there, and I do all the female exams. And before I start my day every morning, I gather together all of the young women who are new to the campus, and we sit and talk a little bit about birth control and about sexual activity and about prevention of sexually transmitted diseases. And I have been involved in this throughout the county in several different schools, working on a task force trying to come up with curriculum for health education and sex education for our young people. I really feel a very strong pull toward the youth because they are being faced with choices and decisions that a lot of us older people didn't have to face at quite a young age as they are now. And I think it's really important that we not only educate the young people, but we need to educate the parents as well. I think that's one of the more important things. Not that they don't know about these issues, but it's hard sometimes to talk to your teenager about sexuality and sexual issues. And so I would like to be able to help out with helping our parents feel more comfortable in that role, because kids really do respond to their parents' education more than they do anyone else.
The role models.
Right. And so it's just an issue that I'm very connected to and I feel real strongly about. Our children are our future. And if we can help them to make healthy choices for their lifestyles, so that by the time they get to adulthood, they can make free choices without having a lot of encumbrances like sexually transmitted diseases that they have to carry with them into the future. I'd like to be able to help with that.
So do you see STDs, sexually transmitted diseases, on the increase in Lake County?
Not necessarily on the increase, but very steadily there, and very, very common, extremely common. Sexually transmitted diseases are a problem wherever you go in the United States. And there are a lot of pitfalls, there are a lot of problems with some of the STDs that we're faced with today. Some of them are incurable. Some of them are silent, so that even though you have them, you may have no symptoms that tell you that you have the problem. There are a lot of problems with it, and young people especially don't have any idea what's going on. And this is not a problem that's just affecting our young people. A lot of young adults, a lot of adults who are out in the dating pool for the first time, having just maybe had a divorce or whatever, are facing some of the problems with STDs that they didn't realize they would ever have to encounter at that stage in their lives. So there's a lot of issues to be discussed and dealt with.
How does self-esteem affect all of this?
Well, especially for the young ones. I think that when young people like themselves and when they feel strong about who they are, they're more likely to be able to say no to situations that might get them in a place where they could have indiscriminate sex or a casual one-night stand, or maybe get drunk and have sex with a partner that they don't know. Self-esteem is really, really important in helping them to be able to make the decisions that they need to make at this stage in their lives. It's very helpful not only in these kinds of issues, but in everything that they do in their lives. And unfortunately, the society that we live in is in a situation now where it takes two parents to make ends meet financially. So our parents are working all the time, so they're not able to give the children the attention that they so often need. So sometimes kids are left to their own devices, and I think a lot of times they don't realize their worth, and they don't understand how precious and how important they are to the world and to our future. And so they aren't making some of the decisions that can help them to become really healthy, functional adults.
How are you trying to increase that self-esteem?
Well,
I mean, I hear the model, I hear the symptom, I hear the ulcer. How do we heal that?
Well, I think, again, education is the most important thing we can do. I think starting with the parents, working with PTA groups and in the schools, helping them to understand that this issue of sexuality is really quite major. I think a lot of us would prefer to think that our children are not sexually active, but the reality is, and I know this because of several surveys that we've done in the local schools, both at Two Eagle and Ronan and Polson and all of these schools that
Charlotte and Early.
Right.
They're all Lake County.
The kids are sexually active, and it's happening mostly at parties where there's drinking going on and that sort of thing. So I think education is the most important place, starting with the parents, and I think we need to have curriculum in the schools helping these kids to understand that it's okay to say no, and that it's not necessarily cool to be sexually active all the time, and that liking yourself and standing aside and separating yourself from the crowd is an okay thing to do, and to be able to say no. So I think truly education is the most important thing we can do.
Okay, so somebody's sitting out there right now, and they've heard what we've been talking about, and they say, this lady has something that I would like to tap into. I mean, I want to have her come in and talk to my class, or come in and talk to my daughter or my son, because I mean, boys do have a role play in this thing. How do they get hold of you?
They can call me at the Medicine Tree Clinic, 745-3600, and they can either try to contact me personally, or they can reach me through Kathy McClure, who's our marketing and education director. And I'd be happy to come and talk. I've done a lot of speaking around the county talking about this issue, and I'd be delighted to do that.
Okay, well, that number again, I'll say it a little bit slower.
Okay.
1-800-745.
Well, it's 745-3600, yeah, and it's 406.
Yes, but you have an 800 number.
Yeah. And one thing that you just said triggered something in me. I do see young men as well who have problems with sexually transmitted diseases, or if they're young teenagers or any aged man actually who thinks they might have a sexually transmitted disease. That's also within my realm of practice.
Okay.
I definitely take care of that as well.
And you can see the positive of that. Now, you know, we all know that the Medicine Tree is sort of known in the Valley as the natural place. So how does what you're doing work into the mold that you have up there? I mean, the model has been made of alternative medicine? Well,
what I think we're discovering in medicine today is that we certainly don't, in allopathic medicine, we don't have all of the answers for everything. So chronic illnesses, pain, some hormonal problems, those kinds of things are things that alternative medicine seems to do a little bit better with. So when I have patients who come in and are having difficulty with, say, something like premenstrual syndrome, which is a problem that women can sometimes have with the fluctuation of their hormones prior to their menses. Sometimes working with diet and nutrition, lifestyle changes, things like getting them to start exercising and that sort of thing, as well as putting them on vitamin and mineral regimens can really help with those problems without having to put them on some form of drug to make them feel better. So that's one of the ways that I use it. I also work very closely with our homeopathist and our acupuncturists and some of the other folks that are available to us, and send my patients to them because they are able to help with all kinds of problems. Menopause is another area where natural medicine works quite well. Some women who are having real difficulty getting their menopause symptoms under control with allopathic medications can sometimes be greatly relieved by alternative vitamins and homeopathy and all sorts of things of that nature.
Okay. What do people mean when they talk to you about body-mind connection? I mean, I hear this, I read about it, I've been involved in certain things, and there's no rule of thumb. So what is your rule of thumb on
What
this?
is my rule of thumb? Well, something I have known intuitively ever since I first started into this field, which was 20 years ago, is that our bodies are very definitely connected to our minds. What we think affects how we feel. Okay, so there's a very strong connection there. If we are emotionally upset, we can, in fact, cause ourselves to have maybe chest pain or maybe a cramp someplace in our stomach or maybe a headache. Everything is interconnected. Okay, what we now know is that our immune systems are directly connected to not only our physical body but also to our emotions, so that our immune system hears everything that you say. So if you're in a very stressful situation, your immune system is having to work overtime to keep you from having one of the viruses that, say, we all normally have, like the cold virus. Everybody carries that virus in their body, and when you're extremely stressed out, your immune system is working overtime to suppress that virus so that you don't become ill. So there's a definite connection to how we proceed and how we view ourselves. if we are happy and content in our lives, then we're probably likely to be much healthier physically as well, okay? There's a lot of studying going on about this issue now. A lot of work is coming out. There's all sorts of organizations that are that are developed right now that are talking about this connection, and I'm really happy to see it because I know that it's true. I know that when I'm happy and I'm taking good care of myself, I don't get sick. And when I'm stressed out and when I'm not getting enough rest and I'm not eating right is when I'm most likely to become ill. Something.
So you have some peace in your life, and how do you think this affects people with cancer?
Well, nobody knows what causes cancer, okay? But I do know that there have been people who have been able to heal their cancers by doing things as simple as visualization, seeing the cancer cells being eaten up by the good cells and that sort of thing. I think that if you have a belief system that is really deep and true inside of you, that you will be well again. Some people have been able to manage to become well and to cure themselves that way. Nobody can explain it. Nobody, people are still studying it and writing about it. We haven't figured out how to bottle it and sell it yet, but I know that it's possible.
Well, someone's trying to figure out how to bottle it and sell it because there's an economic system out there that's run by greed sometimes.
Right.
Well, Diedre, it was great having you on.
Well, thanks.
You know,
I enjoyed being
we
here.
spent 20.5 minutes just like it was nothing.
Yeah.
And I think you gave some real valuable information. I do have one more question.
Okay.
Do you always look this naturally beautiful? Or?
I hope so.
Well, good. I do appreciate what you shared today. If anybody wants to get hold of you, they can get hold of you at the Medicine Tree in
Correct.
St. Ignatius.
Right.
And I look forward to seeing you down the road sometime.
Thank you, Larry.
Thank you for being aboard.
You're welcome.
And I want to thank everybody for watching today, and we'll see you next week. Good day.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care. And we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at